Well, it's 4:30 right now. Warm welcome, everyone. Good morning and good afternoon, depending on where you are located right now. I'm Jingmei. I will moderate the LinkedIn Live webinar today and will quickly walk you through our Bayer G4A Digital Health Partnerships Program. So now let's first take a look of today's agenda. Well, I will give you a brief introduction of G4A about who we are, what's the role we play, and some great achievements so far. Then I will show you the partnership opportunities with us in terms of which areas we are focusing on this year, what are the criteria when we select companies, and what's the program application process. And of course, at the end of today's webinar, we will have the Q&A session, so you have the chance to talk directly with our G4A Managing Director and Program Manager as well. Then just a short reminder, if you have any questions popping up during my presentation, please don't hesitate to put them in the chat and we will leave them to the Q&A session. As you see on the slide, G4A aims to change the experience of health and enables health for all through digital solutions with the commitment to equity, access, and sustainability in healthcare ecosystems. What we do mainly is to build a bridge between buyer and innovators, like startups, investors, and other stakeholders who have already or will contribute heavily to the digital health ecosystems. Therefore, we offer a variety of partnership opportunities, from commercial ones to co-creation, M&A, late-stage investments, as well as early-stage startup investments. Then, let's take a look at the history of G4A and some milestones we have so far. As you can see from the timeline, G4A started as a Berlin meetups in 2012 when we established the cultural change model to connect Bayer with local ecosystems in Berlin. 2 years later, we became the first accelerator that was established by a pharma company. In 2017, we launched our Digital Health Partnerships Program, and then in 2019, we further developed it into 2 tracks: growth track for early-stage startups and the advanced track for the ones more mature. Last year, in 2021, we launched the G4A Strategic Digital Health Investments. Meanwhile, we started to invest more in each company from both tracks. Well, 2021 was a huge success. It has been a record year for us to boost the global engagement in the digital health ecosystems. We have over 3,000 startup networks across 62 countries. Within our 95 portfolio companies, 90% of them had great achievements, which contributed to $3.6 billion to the alumni value in total. Our global community has more than 65,000 active members across the world, with 3.2 million digital impressions overall. Also, I'm so proud to say that G4A was listed as top 1 health tech accelerator program in Europe. Then I will introduce our 2 tracks in details, so it could give you a better idea what's the criteria and which track your company may fit in. Well, both 2 tracks offer you the opportunity to partner with Bayer through integrated care solutions in digital space. Growth track on the left side, as you can see on the PowerPoint, it is more like an accelerator, which opens to early-stage startups, from seed round to Series A. But bear in mind, you need to have the minimum viable product with ongoing validation or published findings. Once you are enrolled in our program, you will benefit from maximum 100,000 euro convertible loan, co-working space in Berlin, and also one thing quite meaningful is that you will gain values from executive mentorship and coaching opportunities from both buyer and the industry experts. Regarding the advanced track, it's about commercial partnerships, since we are looking for companies have at least Series A fundings. Some companies that has published validation and clinical trials. you should already develop products on the market. Therefore, you have traction with users and gain revenues afterwards. But in terms of partnerships, unfortunately, I cannot tell you right now which one exactly will be between you and us. Either it's commercial deals, co-creation, joint venture, or investments, because it really varies case by case according to what kind of company you are, which solutions you provide, and specific negotiations you may have between your company and us Bayer G4A. But you will definitely benefit from the collaboration with Bayer and the networks we have. And then on the following slide here, I will show you which areas we are focusing on, or we call them which challenges we are tackling. This year, we have 5 key challenges, including cardiovascular diseases, mental health, women's health, radiology, and oncology. Each has different eligibility requirements with either a growth track, advanced track, or maybe both. Then, to be more specific, there are 3 different categories under cardiovascular diseases. For patient monitoring and digital biomarkers, we hope you can track disease progression, treatment effectiveness, and support early diagnosis, as well as provide digital biomarkers to predict risks. Next one is the social support. Companies are encouraged to apply if you can connect related people and increase connectivity for severe patients to access direct consultation or care coordination. For the following one is the diagnosis and treatment of CKD, which stands for chronic kidney diseases. It's a main cause of cardiovascular diseases, so we are looking for solutions that can facilitate the diagnosis process, such as, for example, like the identifying high-risk groups who have CKD or which stage of the disease it is right now. And also besides, if your company can offer better treatment and care for CKD, you definitely fit in this category as well. The second main challenge is mental health and mindfulness. We are looking for companies that can provide digital health solutions or platforms maybe to help manage and improve mental well-being. Also, as you can see on the slide, that the following 3 challenges are still left ongoing on our side. But if you are interested in any of them, stay tuned and check our website in the later stage of the year. We will definitely release more information about that afterwards. So if your company offers solutions that can address any of the challenges above, feel free to apply, and we are looking forward to reviewing your applications. Then I will elaborate a bit about how to apply for our program. A big change this year is that we decided to have open cycle applications. In other words, our application portal is open all year round, so you can submit your application anytime once you feel ready. The application process is also quite simple with just 3 steps. First, you need to decide which track is suitable to your company. If it is really hard for you to decide, you can simply click on the button Unsure, and we will decide that for you. Secondly, you should check our website on which specific challenge you are tackling with. And it's even better if your solution tackles multiple ones. And then the last step is just go to our website. On the top right corner, you will find the button Join Our Portfolio. Click on it and submit the online forms through our due diligence portal. It usually takes around only 30 minutes, so it won't take long. Well, okay, you already have an overview of our G4A program. Let's move on to the last and most important session, Q&A part. If you have any questions, just drop them in the chat. Now, I will leave the floor to our G4A Managing Director, Sophie, and Program Manager, Bharat. They are more than happy to answer all of your questions.
Thanks, Chinmay. And I think we got our first question in. So what stages of care are you interested in? Home care, hospital care? So for us, we're looking at everything. I know that's not super helpful, but for patient monitoring specifically, I think that's what you're referring to, maybe that challenge. But then for the monitoring, we are looking at more home monitoring, but also there is an aspect to that where we are looking at more of care coordination. And so my answer will have to be both. Because we don't leave any stone unturned. And so I would say both for that. And I don't know if Bara, if you would like to add anything.
No, that works. Yeah. Next question. In the previous webinar in communications, application reviews were described as rolling with response occurring within 30 days. However, it sounds like the first round in 22 was more of a cohort with reviews starting on a specific date. Can you clarify and provide information on when responses can be expected? So in terms of how this operational, or how this open cycle works is, yes, we are keeping it open on an annual basis. And once we receive a submitted application, we take it through the internal due diligence. And this due diligence takes roughly 1 quarter, so 3 months. Essentially 30 days for various internal colleagues, and then additional 60 days for experts to review it. So in terms of the first round of reviews or first round of communications, you can expect to hear back from us within 90 days is what was clarified. If it wasn't clear in the first webinar, that's what we meant. But thank you, Kerry, for your question.
But thank you for pointing that out. I think what Katie also means, Bart, is that we may have 30 days somewhere on the website, so we should change that.
Mm-hmm.
What stages of solutions are you looking for? So we are actually looking for both stages, so early and late stage. But to clarify, specifically, you can find the specific types of solutions we're looking on our website. It is pretty specific, so I would highly recommend you guys go on there and look at it. But when we say early stage, we do require that our sweet spot, funding is not everything, because we've seen companies that are privately funded that have a fully functioning product and are already, making revenue, commercialized in the market. But when we say early stage, there must be a minimal viable product. And this product or platform or solution, whatever it is, should either have publications already available with some level of evidence, or it should potentially be going into the pilot stage. And so with our partnerships program, what we really try to do is to offer an opportunity for us to actually collaborate with even early stage companies, which means that unfortunately we can't offer clinical trials, but we do have partners who do offer that. And we would like to see early stage companies that can go into these trials and that are available to are ready to go into these trials. So usually when we do look at it, sometimes even some of our early stage companies are offered joint collaboration opportunities with some teams within our organization. But usually these early companies will already have a product in the market ready to go. When we say late stage, this usually means companies that are fully generating revenue, have already had the certifications in place. A lot of these companies already have had pivotal trials. A lot of these companies already would have certification, CE, GDPR, even FDA most of the time. And when we say advanced track, we mean companies that are ready to commercialize already, that are already commercialized, that already have partnerships in place with other large partners, like whether it's pharma, whether it's hospital payers, etc. And so that's kind of how we define advanced. But for growth, we are looking at companies, but we do recommend that there at least be an MVP in place. So I hope that question helps.
When will there be an ophthalmology challenge again? Yeah, so this is actually in how we work with internal business teams, especially the ophthalmology TA as well, is until unless they are actually ready to run the challenges and they're ready to actively look for companies and partner, we don't actively publish them on our website and our marketing efforts because we don't want to waste anyone's time, right? So we want to make sure that the business team is actively ready and looking to partner with companies before we publish those challenges. So that being said, the ophthalmology team is actually currently clarifying various unmet needs and their strategy in order to set up this challenge. In terms of timeline, we are expecting it sometime later this year, potentially. Maybe Q3 is what we are expecting. But yeah, to be disclosed. Please keep an eye out on the website and just follow our social media pages. We will definitely let you know as soon as a particular new challenge goes live so that you can get alerted.
If we are not accepted, will we receive feedback as to how our submission fell short? So we do get a lot of applications, but with that said, yes. If you, for some reason, are not accepted and you write back to us asking for this feedback, we do it on a first come, first serve basis, and we are more than happy to let you or your company know as to why you did not make it to the next round. So yes, short answer is yes, but you do need to reach back out to us and ask for that feedback.
What diagnostic tests or procedures, i.e. hormone tests, urine tests, renal flow scan, are you most interested in?
I can maybe take that. So
Yeah.
we're not necessarily interested in a particular test. We are more interested in understanding the outcome of said tests. So the companies that we are looking to partner with, it doesn't matter what kind of test or scan or whether it's an AI, whatever it is, we would like to see credible proof that A, the solution works, and B, comparatively to standard or gold standard tests, how good of an outcome we can get for some of our said challenges. So I hope that helps as an answer. But for the most part, we don't have any particular test that we are looking at. We're looking at a very wide variety, and some of the applications that we've already received are a very wide variety. But a lot of our experts will then start diving very deeply into, whatever the test may be, whatever AI solution it is, or whatever the platform is, understanding what the sensitivity or the specificity is based on the gold standard, how this technology achieves the current challenges that we're currently looking for, and how big of a strategic fit it would be based on the solution that you provide. So,
yeah, any digital health solutions that are facilitating the diagnostic process as well. For example, the CKD challenge, those are also of interest for us. Yeah. Would stroke qualify as a cardiovascular disease? Closely related example, AF control, overlapping risk factors, and biomarkers. Stroke. It of course qualifies as a CV disease, but in terms of our active focus, it would not be the main disease that we are focusing on within the cardiovascular space for us at this point. What is the selection process? Sure. So in terms of the process, and like I mentioned previously, it's a 90-day period. So once you submit your application on our portal, we will then take it through a number of rounds where both various teams and experts review your application. And depends if you're applying for a growth track or advanced track. If it's a growth track, we then, based on which round you qualified, we can then get back to you based on the various questions and additional feedback that we got from the experts in the various rounds. and get back to you for clarifications. And then finally, we select based on those clarifications on the semi-finalists for the growth track companies. For the advanced track companies, if you do get selected in the final rounds, we then reach out to you for additional information that was collected during these review rounds and questions. And then we put you in touch with the direct stakeholders and leadership team within IC or within integrated care or with the specific therapeutic area business team. And then we take those conversations forward that way. So that would be the process.
Respiratory disease impact in women's health could be a suitable line of work. Example, prevalence of COVID or long COVID in women, COPD or asthma in women. So currently at the moment for women's health, we are not looking at specific COPD or any respiratory disease related products or solutions. However, with that said, I'm going to go back to what Bharat was talking about with our ophthalmology therapy area. It could be, Bayer does work in chronic cough, surprisingly. And our pulmonology team could potentially bring out a challenge later this year as well. But currently, we are not looking at solutions specifically for respiratory diseases in women. But with that said, again, please check back later this year because it could be that we may have certain challenges that are upcoming from different teams within our organization.
I have a commercially available digital therapeutics for metabolic syndrome, and I am looking for a partner to pilot it for free for 6 months for up to 100 users. Should I apply? Yeah, please. Go ahead and apply. We'd love to see more on where your company is at currently and what space exactly it's targeting. What do you mean by metabolic syndrome and which disease area? Would love to learn more. And we definitely partner and this would be a commercial partnership here to run a pilot with you. And we would definitely be open to running that, but we would first have to look into your application further. Sophie, anything you want to add?
No, I was going to say, everyone loves to hear the word free, but please, when you do apply, just make it very clear that you are looking for a pilot partner and that, because if Bayer cannot partner, if we do see that your company could potentially be a good fit for one of our other partners that we may have, we could, reach back out to you and see if you'd be interested in maybe running a pilot with a potential employer or another hospital system. So, our networks are wide and it has happened in the past where, Bayer may not be able to offer a commercial partnership, but if we do see that, your company or product or solution is a good fit with other partners that we have access to, then we may also connect you as well. So definitely apply. And thank you for asking the question. Can a company that has been in the G4A program previously apply for the growth track? Yes, but we would like to see what that growth between joining our previous growth track and now looks like and what exactly you would like to get out of the program. But absolutely, it's our 10-year anniversary this year. Been around for a decade. We have, portfolio companies that are still around from 10 years ago. And so hopefully you're at a point where everyone is a bit more advanced and ready to commercialize. But absolutely, if you're ready to be commercialized, then you should definitely apply again.
Do I own the intellectual rights to the software or technology once developed? Yes, short answer is yes, but it depends on the type of partnership. So if we do a co-development kind of partnership, then it would depend, and we would have to probably discuss in the contract negotiations, but it would likely be a co-ownership of the intellectual rights there. But if it's through the growth track and stuff, we do not take any rights on your intellectual property.
We actually prefer that you own it. So that's our short answer there. But it's highly dependent on the type of contract, collaboration, and partnership. Does your sector mental health include also mindfulness eating, especially to avoid an eating disorder? We have a digital coaching product based on nutritional psychology. Good question. So we are, with mental health, we are leaning more towards behavior change. So short answer is with mindfulness eating, yes. It would be interesting to look at your product. However, we are also trying to tie it closely with cardiometabolic diseases. And so not necessarily eating disorders, but if your company can support people to lead healthier lives through mindfulness and nutritional psychology, then that's something we're definitely interested in. So yeah, I would say short answer, you should still apply. Would be interested to look at what your company has.
Yeah, please let us know if you have any other questions. Please post it in the chat.
Yeah. One-on-one. We're live, by the way. This isn't pre-recorded.
Yeah. What type of business models are you looking for? We're looking for all kinds of business models. Short answer, it depends on the type of company and type of partnership that we're building. Also previously, Sophie mentioned that on the question of the hospital care or direct patients. So based on that, you could be directly working on a B2C or B2B or a B2B2C kind of model. So that's fine. There's no restriction on that. So yeah, please apply. There's no restriction on business models. Any other questions? Are we able to submit multiple applications to different tracks? Kerry, I mean, if it's two different companies, yes, sure. But if it's the tracks are set up in such a way that depends on your company's stage. Is it a early to mid stage company or a late stage company, right? If it's an early to mid stage company, then it likely belongs in the growth track. If it's a late stage company, then it likely belongs in the advanced track. So if you're not sure which track it belongs to, please, there's an option in the portal that you can click on unsure. And while we review it, we'll put you in the right track and take you into consideration. So no issues there.
Cool. So any other questions? If not, you can always contact us. We do have a contact form on our website. All of our challenges are updated on there, and you can check out the diligence portal at G4A.health just to get an idea of some of the questions that we ask through our due diligence process. So feel free to head over that way. Final chance.
Yeah, there's also an FAQ section on our website for some of the common questions. And you can also reach us on our mailbox, info.g4a@bayer.com. So yeah, you can, in case you didn't get to ask your questions here, you can send your questions there as well. Yeah, and there you go.
There you go.
Yeah.
That's a direct, our direct email, info.g4a@bayer.com. And we check it almost every day. So we'll definitely get back to you as soon as we can. Yeah.
Great. Thank you so much for all the questions, and thank you for attending.
Yeah. Thanks everyone for joining. Have a good rest of your week. Happy Wednesday. Almost to the weekend.